assistant here with extramural grants.
Hello, this is Shannon Pear, and I am the person who's going to show you how to use Proposal Central.
Hi, I'm Janet Harris, and I'm just observing.
Hi, I'm Stella Jones again. I am the program coordinator for the Health Professional Training Grants program. If we could get everyone to mute their phones so there is no background noise, please.
And this is Ginger Krawick. So I am the Scientific Director for Health Professional Training Grants, and this is one of the programs in our portfolio. So thanks for joining us today. My memory is pretty long, and I don't think we've ever had training grants in either Ohio or Miami, so I'm really delighted to have you join us today, and the more the merrier. A couple of pairs of ears is always helpful. So I always like to start with a little bit of context because just because we work here and know this stuff, you may not be as familiar with ACS, but we feel very proud of being the fact that in the U.S. And among like organizations, we are the largest provider of funding for training and cancer research. So obviously NIH spends a lot of money in this area, and some other nonprofits do, but so far we're leading the pack. And we have spent almost $5 billion since the mid-1940s. And we feel the money's been very well invested because we have a system that we feel allows us to pick really high-quality people and programs, and 47 of our cancer researchers have received the Nobel Prize over time. So that feels like a pretty good track record. And I just want to give you sort of the broad mandates of the program. So we've probably since, I think, the mid-90s had a focus on people beginning their careers. And also, we don't tell people what they should research if you're a cancer researcher. We allow the investigators to tell us what are the important questions to ask, including in oncology social work. So our goal is to balance the research and the training that we fund to the extent possible. We do get a lot of applications in, so it's really not that hard to sort of spread things out. But we want to fund all the way across the continuum, and you'll see how we organize around that in the next slide. We have had a long-standing funding program to increase health equity in cancer, but by and large, as I said, we don't tell people what they should be doing. And the program that you're interested in, obviously, are our training grants program, and that's where we're going to focus now. So I mentioned that these grants are part of our program portfolio. There are five other program offices, and I'm just showing you this so you can understand that we do fund research and training across the continuum, from really fundamental research over there on the far left, right up through cancer prevention and control research, and then health professional training is its kind of own little umbrella. And what the takeaway from this slide, I guess, is that all of the programs to the left of the blue umbrella are organized by a topic, like biochemistry or immunology. And those committees all review research grants related to those areas. In health professional training, the committees are more organized by professional area. So there is a committee comprised only of oncology social work experts, and that's why that's circled there, and that's what those letters stand for. Those are the committees that do all the hard work. They have to review about 1,500 grant applications a year, and they're the ones who look at them in depth and make recommendations for the ones that can be funded. And the Health Professional Training Grants Program is small, but I think impactful. Last year we spent about $2 million in total, and that's about what we spend. And the goal of this program really is to fund the best people we can who are going to be able to use evidence-based research to improve cancer control and patients' outcomes. So I know that you really want to hear about the Master's Training Grant, so let's get into it. These grants are a little bit unusual. We have a few that are institutional grants, but that's what makes this different. So the grant is not awarded to an individual person or an individual master's student who's getting the training. It's awarded to the site where the training happens. And because of the way oncology social workers specialize, we expect that the site is going to be able to introduce people to the special needs of people with cancer and their families, and prepare the students for direct clinical practice. If you're funded, it will be a 2-year grant, so it's $24,000 in total, and each year you nominate a student to be the ACS trainee. The funding is divided into $10,000, up to $10,000 for the student, and then the remaining $2,000 a year is for the field instructor and the faculty who are engaged in the training program to use for professional development. These grants are also unusual in that they can be renewed. Very few of our grants are renewable, but these are institutional training grants, and so that's why. The students who can be nominated have to be second-year students, so they're at the point of doing their clinical internship or placement. They could be an advanced standing BSW to MSW student. Ideally, they're going to have demonstrated or articulated an interest in oncology social work and have some prior social work experience in healthcare. The students do not need to be U.S. citizens. So this is a change over the past couple of years. They can be a U.S. citizen, they can be a permanent resident, they can be a non-U.S. citizen. But if they are a non-U.S. citizen, they have to have a visa that's going to allow them to stay in the U.S. long enough to complete their program. And then if they graduate and go back to their country of origin, we think that's just wonderful. So those are all the things you're going to need to keep in mind as you think about nominating your students or maybe your student population. One of the things to mention is that if you are renewing your grant, and this doesn't really apply to you, but renewals must include the critiques of the prior application and address any progress being made. So if you're successful in getting funded and then successful in getting funded again, the committee really wants to see progress over time as to how the program may be evolving based on feedback from the committee or from the students who go through the program. So these points are spelled out in the program requirements, and this is really all the things that you need to have in place to be able to apply for the grant. And I'll go over these in a little more detail in the next few slides. When we talk about faculty, let me just mention this. We're talking about the other people on site who will be assisting in the training of the student. So there will be a field instructor and there may be task supervisors, but you may also be pulling in other people. And you should also keep in mind that the entire review criteria are included in the application instructions. So if you go to Appendix D, you will find the instructions to the reviewers as to what they're supposed to be looking for and rating in an application. So when we talk about a qualified field instructor, we mean somebody who has a master's in social work, ideally with advanced credentials, and also a minimum of 2 years of oncology practice and 2 years of supervisory or field instructor experience. The biosketch in the application is organized in a way that as Stella is reviewing them before we send them out to the committee, she can easily see if you've got an MSW, if you've got 2 years of oncology practice, if you've got 2 years of supervisory experience. So please, please use the form provided. That's a requirement. Also, you're going to see on this slide that professional and service activity in oncology social work is underlined. So that's because we expect that the field instructor in particular, but also the other faculty, will really be modeling professionalism in oncology social work to the students. And to that end, the reviewers added an appendix to the materials, Appendix C. They wanted it to be clear what they meant when they were talking about expected professional activities. I think it would probably be super social worker who had them all, but if you look at that list, it includes things like advanced credentialing, presentations at professional meetings, professional memberships, and more than being a member, also being active, particularly as a leader. Maybe you've been involved in publications, maybe you've been involved in research. Those are all the things that we hope that the social workers being trained through this program will be aspiring to in their professional careers. And those are the ways that you can demonstrate your own professional activity. In the materials, we also asked for a narrative about the field instructor and the other faculty. So in both cases, the reviewers want to know what the roles of the identified faculty are, particularly in supervision and training. And they want to know explicitly how much time the faculty are spending with the students. So the field instructor is probably going to provide the most information there, how often you might be meeting with and supervising the students, whether you are participating directly in training. And then the other faculty, we're expecting to see the same things. And you can identify up to 5 additional faculty. So there might be an oncology nurse who's in a position to talk about treatment and the side effects of treatment, et cetera, including maybe cognitive or emotional things that that the students might be perceiving. There might be a chaplain participating. There might be a physician instructing them about how radiation oncology is provided, et cetera. And so those people can be considered faculty, and even if they're not working with the students through their entire internship, if they play a key role in training them on an important area of content, you should include them as faculty. You can also include other people, and the application talks about, what other multidisciplinary faculty are you including? And they would be considered not key faculty, but the more exposure they have to all the different members of the multidisciplinary cancer team, the better it is. So the peer review committee really wants to know how big the Department of Social Work is, what it does, and particularly how it relates to the larger organization. They look to see what proportion of the institution's patients are seen by social work. So if there's a large number of patients and most of them are seen by social work, that's great. They may question if only a small number of patients are actually seen by the social work department. And when you're providing that kind of information, they really want to see both data and some descriptive information. They're also going to be checking to make sure that there's enough staff to handle the patient load. So it's really not fair to the faculty or to the student if that ratio is out of whack. A student can be a great help once they are maybe 6 months in, but that first 6 months can be really rocky if there's not enough people to train them. And they're going to be looking to see how you're connected to community agencies and resources, including ACS. And we specifically require a letter of support from the region. And we can help you. If you don't have a relationship with your local American Cancer Society, we can put you in touch with somebody. But I can guarantee you there is someone in Miami and there is somebody at Ohio State who has a relationship with the university. The reason for that letter is our divisions, or our regions, are the people who raise the money and work in the community and partner with cancer centers to advance our mission. And they are very interested in knowing who's funding, and they also like to know who their potential partners are. I hope that if you apply, you're funded, but even if you're not, maybe there are some opportunities that would arise from getting connected. One of the headings in the application is about the institutional cancer program, so we really just want to know that this is a site, and you can see the examples of what they might be, that can provide a broadly based clinical training experience. So for example, certainly cancer centers are ideal places because of all the resources, but we do have and have had grants at hospices. There's a high proportion of cancer patients there, or at agencies, social service agencies that provide clinical services. But whatever the site is, ideally there's going to be an organized multidisciplinary cancer program, preferably American College of Surgeons approved, and also the opportunity for the student to train in a variety of settings, so inpatient, outpatient, acute care, all the places where patients essentially get treatment these days. If the site deals with primarily one cancer diagnosis, you'll probably want to add some other training sites. I don't think that applies to either one of your institutions. And they're also going to be wanting to understand what the patient population is. Most are pretty diverse, but if they're not, you're going to need to describe how the student's going to be exposed to a broader patient population. Conversely, if you have a diverse patient population, they're going to expect you to take advantage of that opportunity to expose the student to people of different racial, ethnic, cultural, et cetera, backgrounds. The student should also be exposed to a variety of oncology disciplines, and especially a team approach to cancer care. So this is actually your program. So you are designing a training program or describing your training program. Obviously, you have to be affiliated with an accredited school of social work, and they have to provide a current letter saying that they are affiliated and they're placing students or willing to place students. You do not have to get letters from past affiliated schools. It's only the active affiliations we're interested in. And if there is the school that places students with you doesn't have a healthcare or mental health concentration, that's okay. That's a preference. Block placements are also okay. So you may be affiliated with two schools, one that has a regular 2-semester placement and one that has a block placement. That's fine. Regardless, Stella's going to be looking for letters. If you say that you have an affiliation, those letters need to be in the application. You also have to identify a pediatric or an adult training focus. It's okay to expose students to both, but there needs to be a prime focus for your program. And just to go back to the school a second, there's really no reason not to work with the school if it's appropriate in developing or enhancing your program. We do expect, at a minimum, there's going to be integration with the coursework. And of course, you're going to want to work with them on the selection process and maybe even deciding on the criteria for nominating students. And as an aside, anything oncology social work can do to infiltrate master's programs is a really good thing. So don't be shy there. You're going to need to lay out explicit and appropriate and comprehensive training objectives. I'll get into that more. And you're going to have to describe both coursework, essentially, didactic, lecture training and experiential training in the program. And whatever your educational objectives are, the activities are going to need to address how those are going to be achieved. And again, I'll get into that more shortly. So here shortly. I think this is fairly self-explanatory, but if you look in the application materials, this all comes in under outline of the program for trainee, and we allow up to 10 pages. So the committee really wants to see detail. A is educational objectives, and it needs to be based on standard practice and theory. It should be aimed at master's level students and clearly oncology specific. And the goal should be to lay out objectives that will allow you to measure their attainment in knowledge and skills and behaviors. You need to include self-awareness and self-care and orientation to the healthcare team, and also, ideally, an introduction to oncology social work research and evidence-based practice. B on this page is going to ask how your training program is integrated with the School of Social Work. So the students may be taking courses and then doing their assignments through their training at your site. So you need to describe how that's happening. So I can't emphasize too much how important this portion of your application is. It's not enough to lay out educational objectives. You need to describe how those are going to be achieved. And you need to be specific about what is required for the students and what is optional. And I'm just going to reiterate that it's okay for the program to be based in one oncology specialty area, but you do have to include here how the student's going to get a broad-based training experience. They also will want to know how content related to the needs of diverse populations is incorporated, and these are just all written out in the instructions. And again, this is where you would talk about if the student is working with a patient population that is predominantly one, for example, socioeconomic group, you're going to have to explain how they're going to get exposure to others. And the committee is also expecting to see that the majority of the students' caseload is going to be oncology patients. And again, I don't think this is going to be an issue in either of your sites, but that's because they really want to see the program demonstrating that the trainee is going to be able to develop clinical skills in managing the cancer patient and their family. They're also particularly interested in the point at which the student will be acquiring patients and how that happens. They become very concerned if they see that there's going to be an extended period of shadowing. So they ask explicitly when the student will acquire a caseload and how many patients are expected to be assigned. You're also going to see this section ask for information about the resources that are available to students and also how the $2,000 for faculty development will be used. And I mention that in the same sentence because some folks decide to use that money to bring the student to a local, a regional AOSW meeting or something. That's completely up to you. But you do need to describe how you anticipate using the $2,000 each year. And there's also a lot of interest in the institutional activity. So you will see a request for descriptions of patient population and the community served and the program staff. So they see all those as being related. They're looking to see how your staff may reflect the community and the patient population and asking for a breakdown by race, ethnicity, socioeconomic status, and, if possible, sexual orientation. So your application's all done. Woo! I'm sure your heads are maybe hurting a little bit right now, but don't be overwhelmed. I just want to take a moment to talk about what happens after an application comes in here. You're probably wondering, how do we determine which grants are going to be funded? So we have a 2-level peer review system. If your application comes in October, it will be reviewed in January by the Oncology Social Work Training Peer Review Committee. As I mentioned, those folks are all experts in the field, and there are 17 other committees like them who are all meeting throughout January. They have the responsibility to read the application, provide a written critique, discuss it, essentially advocate for or maybe not so for at the meeting, and then the entire committee rates and ranks the application. And then that ranked list is provided to our council. Our council is people who essentially, they may be senior researchers, but they're also people who have a fair amount of experience with ACS and with our peer review system. So, for example, Sarah Gellert, who is now a dean at USC, and was previously the chair of the Social Work Peer Review Committee, is a member of council. And so her responsibility is to review the recommendations of the committee and essentially affirm that all the applications that are fundable get funded. It's a tough job because the money doesn't go as far as we would like it. But in general, I think they do a really good job. And they don't second-guess the peer review committee. If an application is recommended for funding, it's rare that they would not agree. I also want to mention that on the peer review committees and on council, we have members who are, we call them stakeholders. Some people call them consumer advocates. There's a bunch of names for people who are not experts in the specific area of peer review. We've had them on our committees for almost 20 years, so this is nothing new. But the important thing to recognize is that they are full voting members. They are oftentimes cancer survivors or have been caregivers, not required, but that is frequently why they're interested, or they're longstanding ACS volunteers who particularly want to understand more about our research program and participate in it. So when we assign applications, each application is assigned to 2 experts and 1 stakeholder. Our goal is to have every application looked at by a stakeholder. They all participate in the discussion, and so when you are completing your application, you need to keep in mind that they are part of the audience too, and particularly when you complete your general audience summary, because that's probably where they start, is to understand what you're hoping to achieve with your program through ACS funding. And so the way this works at the meeting, the grants are all scored, and essentially an application needs to achieve what we call an outstanding or a high excellent rating to be funded. It's a pretty competitive process. You should not be discouraged if you're not successful the first time. That's not uncommon, but we will work with you if you need to revise and resubmit. And again, I know you are interested in knowing how many, right? But that's really not the right question, because if you want funding, the way to get it is to apply. I've already mentioned it has to be strongly rated. Your best chance of getting funded is to cross every T and dot every I. But we do not have a target or a set-aside in the budget. So the money that is spent depends on the quality of the grants. And in this program, we have a very high funding percentage, particularly compared to our very large research grant applications. I'm a little disappointed in the numbers, but it means your chances are very good. Last year we got 9 applications. 5 of them were new. 6 of them were funded, which is a funding rate of 67%, which is kind of outrageous. And 2 of those are new applications. So you're always going to be competing against people who are submitting renewals and have done this for many years. There's no guarantee that they will be funded. And as I just mentioned, we had 2 new applications funded last year. So that really should be how you're thinking about this, is that you need to submit an outstanding application. And when you submit your application, everybody gets a letter that tells you where you stand. So that would come to you around the beginning of March. And you won't know who your reviewers were, but you will get their written critiques that outline the strengths and weaknesses of your application. And then you will also get instructions to make an appointment to speak with me if you wish to. And I can let you know if there was any additional comments made at the meeting, and to sort of help you walk through what was said, and then maybe strategize about submitting your application. So I know that's a lot of information for people who haven't even started writing their application, but I hope it's going to be helpful to you. And we're going to open the phone lines so that you can ask questions if you like, and then we're going to take you right to Proposal Central so that Shannon can walk you through it. Does anybody have any questions about the content in the application, et cetera?
This is Lisa. Well, I guess I have a question about the money that's received. I just want a clarification. That money doesn't necessarily have to go to one intern. It could be used for many interns within the 2-year period, correct?
Actually, it's supposed to be used for 2 interns,
Oh, okay.
1 each year.
Got it. Okay. Okay.
And
so
we have
maximum 2, 1 each year.
Yeah, we had one program that had a multidisciplinary psychosocial oncology training program. So there were interns from various backgrounds, and they asked if they could have 2 a year, so that there would be 2 social work students in this group of interns from various backgrounds. But the idea, I mean, we would not really want to have more than 2 funded, because we want you to select a really top-notch student, even if there are other people going through the program, which I know can be a little bit challenging, but that's the intent.
Right. Got it.
Okay.
And then $2,000 for education. Is there any? Could it be used for different types, or does it have to be used for like a conference, or like could it be used for several educational activities with?
Sure. Yeah.
Okay.
No, absolutely. If you wanted to, people want to go to a conference or a particular training, or have an in-service. I mean, one thing that I haven't mentioned before, but it occurs to me, if there is training and supervision that somebody wants to take advantage of, so you have more field supervisors on staff, that's a possibility. That's completely up to you.
Okay.
Okay? And before Shannon gets started, let me just tell you that the end product of this is going to be a multi-page document. And if you haven't seen it on cancer.org, we've provided a sample blank application, so that she will tell you how you get that to happen at your end, but at least you can see, what it should look like from start to finish. So I'm going to let Shannon take over now.
Okay, I'm going to start with Proposal Central. This is their home page. Once you create a profile, an account, then when you go into the system, you will see different tabs at the top. You're going to want to click on Grant Opportunities, and you'll want to filter by grant maker. And so here's the American Cancer Society, and it shows you the different grants that we offer. And you will scroll down to the Master's Training Grant in Clinical Oncology Social Work. You click on Apply Now, and it opens up your application. And the project title is pre-filled, so please just leave the title as is. I'm just going to go through really quick, and if you have questions, you can always ask or ask me offline. So you go through each section. This is Program Office. You would select Health Professional Training Grants. One thing that's important is that you do need to provide whether your focus is pediatric or adult. We have pre-filled the total amount requested as well as the start end date. Please leave that as is. The next section, proposal type, you're going to click on new if you're new, renewal if you're renewing, and resubmission if you didn't get funded the first time you applied. And so I'm just going to click on new, and then I don't have an ACS grant number, so I'll put N/A. You scroll down and you'll see resubmission. Mine's not a resubmission because this is my first time applying. You do have to put something for the peer review committee code, so just go ahead and put NA. It will ask you whether or not this is your first application or second. And so this is basically not applicable. And then you would choose the yes button. You can go back later and read the scientific misconduct. You just click on that link and read through it. So basically that is the title page. You're going to want to save the title page before you move on, so it will keep the information there. The next section is download templates. Ginger was talking about the different pieces of the application. These are the templates that you're going to download and work on offline. You will need, once you're done with that, you will need to create a PDF format in order to upload the files. We'll go over that a little bit later. The next section is if you want to allow others to have access to the application, you can. And you would just type their name in there, and you have an option of them being administrative, viewing rights, or editing rights. And that's totally up to you, and you do not have to give anybody access to your application unless you want to. So the next section is applicant field instructor, and there's information that you would fill out. I already have some pre-filled information here. By the way, anything that has a red asterisk must be filled out, otherwise you cannot submit your application. The system will not let you do it. So I'm just going through the different sections, and you'll see how there's some missing information. So what I have to do is go back into my professional profile. When I created it, there's certain pieces of it that I did not work on or fill out. So basically, I would put in my position title and the mailing address and all that information, and I would go ahead and click the Save button after I've entered information. Then you're going to scroll down to number 4, personal data for applications. And here we go. There are a couple required fields, and that would be your date of birth. We do need your date of birth and your citizenship status. So those are the two that you need to provide. Also, you will need to provide the citizen of, which I'm a citizen of the United States, so that's the one that I chose. Please do not, or if you're a permanent resident, you can choose whatever state that you're from, or country, sorry, if you're from the United Kingdom or anything like that. So you scroll down, U.S. visa type, please do not fill that out. Please do not put your Social Security or your passport number on here. We do not need that information. Once I've completed the missing stuff from my application, I'm going to go ahead and go back to the proposal. So return to LOI proposal, and then you will see that I'm back on the page and there's information that is filled out. The next section that you go to is the institution and contacts page. This information is generally pre-filled at the university or institution if they have an account that is created. So you would want to go in and select the lead institution and put that information in. Now, if this is missing, if your information is not on there in regards to the institution, you would need to contact your Office of Sponsored Programs or your grant office because they would need to create the profile for the institution. If your institution is there and you select it, it'll pull it into here. When you scroll down, you will see there are certain parts that need to be filled out. The signing official, for example, and I picked the right institution, so these are the different signing officials. The department head, I'm going to select, okay, I don't know who those people are, so I'm going to put Ginger as the department head, and I'm going to add her. And I'm going to save that button. And let's see, we'll close the window. And you'll see that Ginger appears as the department head. Same with the medical head. I can put myself on there and then click the add button. And it basically I hit the save button and then I am added as the medical head. So that information is in there. Now the two pieces, again, that you would not be filling out, but you would be selecting, is send checks to the attention of and also the signing official. If that information is not filled in or it's not the right signing official, generally institutions have a couple different signing officials. You would have to contact the Office of Sponsored Programs and have them create one for that account. So that's that section. I recommend going ahead and getting started with this as soon as possible. It can take a little time, and so you'll want to do that. Ginger mentioned the letters of support. The way to send these letters of support is you're going to enter the email address of the person that you are asking for a letter of support. You're going to put their emails in. You're going to click the add button. Okay, great. That's who I am, and I am sending that email and closing the window. And you will see that I just sent an email on today, and the person I asked for the letter of support has not responded yet. These letters must be uploaded to Proposal Central by October 15, 5 p.m. If they're not, then you'll be unable to submit the application. So you want to start early on getting these letters. If it's the case of Shannon never heard from me, then I would click on send the email again, and it will send the email again. So anyways, please note that the minimum number of letters is 2, and you can add as many as 6. So just wanted to mention that. We're moving on to the general audience summary and project coding. So Ginger had mentioned about the general audience summary, so I'm just going to let her briefly go over it again.
Well, very briefly, I can tell you that there is an example in the materials, so you have an idea of what would be a helpful general audience summary. But these are provided to our division staff, too. If a grant is funded, they like to understand about the programs that are being funded in their area, and also potential donors. So donors may have an interest in funding oncology social work in Miami, and in that case we would show them that we have a grant either waiting to be funded or has been funded and that they could apply their funds to. So you shouldn't, I can't imagine there's anything confidential you would put in this, but those are the specific uses for the general audience summary. This next section is going to be really easy for you. If you are proposing a pediatric oncology social work training program, you would likely say 100% pediatric. And if it is primarily adult oncology, you would say 0%. And the reason we ask for this is because there's a lot of interest in the childhood and adolescent cancer community of parents to know what percentage of our grant funding is going to that area. We love to categorize our grants, as you can imagine. That's why we ask for all that demographic information about you, too. So in most cases, I would imagine at a comprehensive cancer center, you would not be exposing the students to just one area of cancer. I guess it's possible. So, but if you are not, you might want to choose 100% not site-specific cancer, meaning that all kinds of cancer are included in the training program. And did we skip right over the CSO, or is that not part of this one? I guess not. Okay, lucky you guys. There's one section you do not have to fill out, so you should count yourselves as lucky.
Great. Thank you, Ginger. So basically you type in your general audience summary. I just typed some stuff there, and it's going to show up later, and I just wanted to show it to you. When you are filling out the childhood and adolescent cancers, please just enter the number. You do not need to put a % sign. and you do not need to do 0.5, for example, and not 50%, just 50. So that's what we need there, so please do that. And that is pretty much it for this section. Now I'm going to move on to proposal attachments. In the beginning, I mentioned the download templates and how you're going to work on them offline, and that when you were done, you would have to create PDFs out of those documents and that you would upload them. So we are now at that section. So you will see these are the templates, again, if you needed them, but you're probably going to get them the first time around. And so basically what you're going to do is you would click on Attach File, and then it will ask you the attachment type. Let's just say it's the CV for the field instructor. Then I would go onto my computer and look for it and basically upload it, and then it will show you that it was uploaded. Please, when your application prints out, you do not need to shift any papers. It prints out in the exact order that it's supposed to. You can't upload different documents at different times. That doesn't matter, so you can jump around here and, still upload something. So, but again, when it prints out, please do not mess with the papers. I probably shouldn't say it that way, but anyway. So I'm going to go to the back button, and I am going back. I will be going back to the proposal section. I'm going to scroll down. We're now at the PI data sheet. You would just click on that to see if there's anything missing. And, okay, my date of birth is there, great, and my citizenship status, and that's pretty much all I filled out. Back in the profile, I did not mention this. We do have questions under personal data for applicants. We do have information that is not required that you can fill out, and so that is these sections right here. Again, you can fill that information out. We use it for statistical purposes only. This will not affect your application in any way. So if you'd like to provide that information, that would be very helpful. I meant to mention that. So also now I'm going to go back and return to my proposal. And I'll scroll down, and we will click on the Validate button. The Validate button is going to tell you what you did not fill out or upload. So I'm going to go ahead and click there, and you will see that there's a lot of stuff I didn't fill out. I didn't fill out the proposal type. I have to go back and do that. Basically, this is all the different information that I did not. You will see, did not do. You will see that letters of support error is telling me that I don't have any. So it's not going to let me submit. That's because my recommender or letter of support person did not upload it. And then you'll see that the missing attachments, I cannot upload as well. So I have to go back and upload that material. The next section is print signature pages, and you would click on print signature pages or print signature pages with attachments. You can do the print signature pages first if you want to, but in order to print out the whole application and the order that it's supposed to print out, you will click on print signature pages with attachments. So let me go ahead and click on the signature page just so that you can see it. Here we go. And you will see that some of the information that I filled out online has been pulled into this section. So you'll see that I kept the title the same right here, so it shows up, this is a new grant or new proposal, and my information basically is showing up. Here's the proposed project dates, etc. Everything is filled out. I didn't choose a signing official, so it's not filled out. So there's certain sections of the application that you will need to fill out before you print the signature pages, and that would be the title page, and you would also want to enter the institutional contacts first before you print this. You'll see that this is a place for the signatures. We do not require original signatures. You can do electronic or however you can get their signature on there. That's great for us. And the second page is application contacts. Now you will see that Ginger's information, because I filled it out, shows up as the department head. and I show up as the medical head. So that just gives you an idea what it's going to look like on the second page. The general audience summary will also print out here, and you'll see where I put some just letters in, and that's where it's going to show up. I did that so you could see it. Anyways, that is these are the signature pages that will print out with your application as well as your attachments. And basically, I'm going to go submit my application, and I'm going to click submit. And as you see, I can't submit my proposal because I have all these missing sections, so I do need to make sure that I upload all these sections or enter the information. Otherwise, I will not be able to submit my application. So this is a quick view of Proposal Central. If you have any questions, feel free to give me a call or send me an email. If you have any questions, please go ahead and ask them.
This is Lisa Murhead from the University of Miami. You went into a lot of details, which is very helpful as I'm viewing it, but is there any way, is this being recorded? Is there any way of rewatching it? Because it's helpful to see it visually as you're going through each section.
We will have a recording that will be available in about 3 weeks.
That was the 3 weeks part. Okay, sorry.
Right,
yeah.
right. No, that's fine. And honestly, if you want to call me anytime, I'll walk through it with you.
Beautiful, because we're very new at this.
Right, that's fine. So yes, I can walk through it with you. We can set up a time to talk, and just give me a call.
Okay, great. And your contact information is, I guess, was it sent?
It'll be coming up in just a moment.
Thank you.
Uh-huh.
It really, I'm sure you're feeling just a little bit overwhelmed because there's a lot of information that goes into all these various screens. But I assure you it's really not as bad as it looks. And the one thing I did not mention earlier is that you likely know a number of people who have been funded. And if you want to check with me, if you don't know anybody, I can put you in touch, and they can give you the benefit of their experience. And I always say, none of us in this room have ever applied for a social work training grant, so it's always a good idea to talk to somebody who's actually gone through that. So thank you, Shannon. And so, as she just said, you can always call us. That's her direct email address and phone number. All the staff are listed on cancer.org, so you can find Stella's information there. And if Shannon and Stella need to pull me into something, they certainly will. And then those are the links to Proposal Central, but those you can get to directly from cancer.org. Stella has a couple of things she wants to mention that tend to occur when applications are submitted, and so I'm going to turn it over to her for a moment if you can stay on the line, and then we'll release you from school.
Okay, yes. So we just want to go back over the address. So on the cover page, the section that has, it'll say your university, and then it'll also say address. So we want to make sure you're putting the address where you receive mail while you're in school. So, should you get funded, then we want to make sure that you receive your mail. We have had some instances where people have not been receiving their award packets, and sometimes we have to resend them. Sometimes they come back to us. So we just want to make sure you put the correct address where you're, what it says, preferred address where you are while you're in school, where you receive mail. Another thing is the term date and the amount. So as Shannon said, they are already pre-filled out, so please do not change that. If you know that you're going to graduate before the 2 years, you must send us a written statement. It could be an email just saying, hey, I'm going to graduate next May or whatever. And we will go ahead and process that, cancel your grant. Or if you're going to graduate December, we'll prorate it, but just let us know if you're going to, do 1 year of the grant or 2 years. And if less than 2 years, you must provide a written statement. Okay. Sorry.
The other program.
Other program, you can skip that part. You can skip that part. So the next part, the signatures. Sometimes we get applications that do not have all the signatures, and they are due by the October 15th deadline, so that kind of delays your application getting processed. So just make sure that once you submit an electronic copy and also the paper copy. So the paper copy must be in our office by the 15th. Is it 15th or 16th?
I think 16th.
So it's 15th for the electronic copy, the 16th for the paper copy. And like I said, everything must be completed. If not, that just delays your application getting processed. So I will usually email you and say, hey, we're missing these documents, please get them in. And I believe that is all the sections that I normally get redundancy on for some reason. I'm not sure. But I just want to make sure, you're not, your application is being processed in a timely manner. Because we do have deadlines and we have to get, everything done. So if you have any questions, like, Ginger and Shannon said, you can contact Shannon, you can contact me, Ginger. We're here to help you. So if you have any questions now, you can ask. If you think of anything later, if you know someone that wanted to be on the call, didn't get a chance to, as we said, it is recorded. We can send you a copy of it as soon as it becomes available.
I have a question. What have past applicants received funding for besides conferences and training?
I'd say that those are the main things that people use them for, or attending a special kind of workshop or something like that. Did I mention in-service? I hope I did. But if you have any creative ideas, you could purchase educational materials. There might be things that, I don't know if there's like study guides for OSWC, but those would all be valid things, or the Oncology Social Work textbook. I know that's a giant and, rather expensive.
Thank you so much. It's Lisa Merhab. I have to take another call.
I saw that, Lisa.
Appreciated.
Thanks for joining us.
Thank you. Take care. Bye-bye.
Bye. Kathleen or Joanna, any questions from you?
Nope. I think that was it. I appreciate your time.
Sure. And I hope I really hope you're not overwhelmed. Just go home and take a few deep breaths. And as Shannon and Stella both said, we'd be happy to help in any way. Put you in touch with colleagues. As I said, you probably know a number of people who've been funded, and I think it's a pretty supportive community. So don't hesitate to reach out to them or us.
Okay, appreciate it. Thank you.
Okay, have a good evening.
You too. Bye.
Bye-bye.